I'm very happy that we're already gathered here today for this event. A lot of interesting topics will be discussed today. A lot of interesting speakers are available today for your discussion points and so on. So once again, I encourage you to discuss, to encourage, to take each other for a conversation, maybe a controversial topics and so on and so on, but always try to grab someone for a cup of coffee and use this day as it fullest. So as it was introduced before, my name is Robert, and I'm an interventional cardiologist. We are today representing the Hospital of Lithuanian University of Health and Sciences. And as a physician, I was asked to give my insights how digital health tools really can induce our daily practices as physicians and so on. So a lot of topics were discussed today, but from a physician point of view, I want to emphasize the main things which we as doctors see every day in the everyday clinical practice. So everyone knows that digital health refers to a lot of usage of digital technologies and how we use them to improve health and healthcare delivery and so on. But for us as doctors, we see the main points which we are asking innovators as you today to innovate, to create things for us doctors and physicians to use in daily practice. For some main points are this support for the monitoring things, for the management, from the improvement of health outcomes for our patients, and a lot of main things, and I would like to emphasize the whole thing for the communication part from our side to the patient side. Very important thing is to talk about digital health technologies and tools, and we know a lot of them, and for the sake of time, we won't talk about all of them, but as a physician, I will emphasize a few of them, how the digital health technologies overall leads to cultural transformation in healthcare today as in daily practice. So telemedicine is one of the topics, one of the high topics in our community, as it involves, it improves the access to the care, it especially in those remote areas, and conveniences, and reduces the whole travel time. Still, we have some challenges through technological access, through various hospitals, the generation of the doctors, and so on and so on. And just a small example for you, like this is the case from last shifted 2 days ago. So for those who don't know, Lithuania is not a huge country, but still we have 3 million people. We have several hospitals, and this patient was referred to me on the call that he is not very typical in symptoms, but still has a lot of pluses and minuses for the diagnosis. So we reached to each other through telemedicine. We discussed, we performed a transthoracal echo, we examined the patient, we checked his ECG, his vital signs, and so on, and he took more pluses that we should take him to our university hospital for the coronary angiogram. And after that, we find a critical lesion in his main artery overall here. Says the left arterial artery, which really would cause his death, sudden death of myocardial infarction. So this patient was successfully saved, basically just because of telemedicine and how it works. Of course, a lot of topics will be discussed today on artificial intelligence and machine learning tools. The most important things for us doctors, that it can help us to analyze a lot of data, a lot of waste of data, to predict analytics, to diagnose resistance, to personal treatment recommendations for a patient. And for us doctors, as we are very busy during the day, these tools are very crucial. Of course, the machine learning algorithms are still in the early development. Some of them are more developed, some of them are less, but still they're gives us the decision-making opportunity as physicians to help our patients in critical moments. Of course, we still at the moment, but already on the market, we have already invented clinical decision support models, which takes a lot of different data. Images, patients' laboratory tests, and so on. It provides us alerts, it can provide us reminders, it can provide us other important incomes and outcomes for the patient. And these models are already on the market and they are used in the hospitals. Very important thing that large language models, as we are better known as ChatGPT and so on, they're already evolving specifically to medicine, and you can ask a lot of specific medical questions. Of course, not all of them are like answered very correctly, but we can already share some scientific data from Nature, latest Nature's published articles that Google invented their large language models, which are 93, let's say, % of accuracy, and helps doctors legally use the tool and help our patient in those urgent moments overall. So another example, so we already have some specific artificial intelligence-based algorithms which we use in the hospital, not in our hospital, but in other projects, which can help us in crucial moments for the patients. I mean that those patients, let's say, who are sick with pulmonary embolism, is a life-threatening disease, and these algorithms can collect very fastly the CT scan, patient symptoms, Robertas, everything connect to one moment, call all the doctors which are on the shift, the ICU, the interventional cardiologist, the daily physician, and share the data, and everyone can be easily connected to one call, and we can discuss very fastly. And this patient came to us with late onset after 12 or 13 hours of already of his symptoms. We took everything out, everything was fine, but still we see a huge gap of innovators which can help us in daily practice. So the future is of artificial intelligence and so on, is the multimodal systems, which really will help us doctors, which can connect images, audio, video, text and X-rays, and give us a very comprehensive answer overall to that moment when we have the patient on the table, as we call. Of course, the language barrier is also very important, as the patient comes. He is, let's say, from Spain. He doesn't speak the native language in Lithuania, so multimodal languages can easily translate my question to the patient and translate back it to me in Spain. The other thing is the wearable technologies. A lot of things covered with these technologies. They give us the heart rate, their smart health monitors tracking their vital signs and so on. And as you can know, we have at this moment in the market, we have quite a lot of them. Some of them are better, some of them are worse, but like overall, we still have a lot of opportunities how we can connect data, and that data can be transferred to the doctor, especially in these situations when these kind of patients come to our emergency room and give the variability of their medication. And usually they say, I take the black pill or the white pill or the circle one and other kind of pills. And we as doctors are not trained to know these pills and so on. And those technologies, not wearable, but overall technologies, can totally change the clinical practice as for us as doctors and for the patients overall. We have smart boxes of pills which totally give us reminders. They have data that the patient took the medication or he didn't took it, and it's already purchased on Amazon, and it's not like a super innovative rocket science thing, but still we still have patients which come to our emergency room with this kind of data, let's say, which if you can call it. So overall, we know from the World Health Organization that until 2035, we'll be short of healthcare workers by more or less 13 million people will be shortage. And with these technologies, I mean telemedicine, wearable technologies, we can easily real-time tracking vital signs of our patients. Of course, we can discuss that even non-physician healthcare professional can perform basic examination and then share the data to your doctor. We can also help and involved, let's say, those hospitals and those patients which are in the remote hospitals, underdeveloped regions, and so on. So these technologies really will change our clinical practice, and it's already changing. Mobile apps, a lot of will be discussed also today, maybe even tomorrow. There are different ones. Not all of them are working for every patient, and we're working on that also, that involve doctors in implementing these apps, and not only creating, but vendors which are just creating apps and so on. So already doctors are on board. We're creating things and helping to create this kind of product, which will salute our patients, as our patients are more and more using App Store, Google Play, and the healthcare, any kind of apps and so on. So with medical apps and other kind of technologies which are related to health, to digital health and digital apps. So it helps us for early detection. It helps us for innovative treatment, preventive care, improved access for the patient, as the patient is involved. He uses the phone. He's interested in the whole thing. Also, we see that the major challenge is that more than 50% of our patients don't take the pills which we prescribe them, of various reasons. It's scientifically based with randomized clinical trials, and fear of side effects, complex medication schedules, lack of understanding of medication. There's a lot of point of views, but still medical apps, medical applications are really helping us to pursue patients with treatment compliance. They understand, they get involved, their lifestyle modification, the self-monitoring, the stress management, if we're talking about health issues and so on. Very important thing that we're already seeing that 99% of our patients, they really stay and manage their health on their own. Only 1% of the whole time overall, they come to the doctor's office, and then we talk with them about their health issues, what we can change, what we can do, and so on. But the biggest time, they're on their own. And we need to have a tools, how we can take them to be involved in the whole healthcare process when they're alone. And health apps are one of those digital markets which really are evolving. We're having more than 3,500 health apps which are available globally, especially during the COVID-19 pandemic. Devices, smart matches, vital signs, and apps are really evolving, and this is a game-changing thing for us doctors. Also, how it helps the patients, as I mentioned before, it helps us and helps the patient for the health track and the medication reminders, which are very important, mainly my favorite things. So daily assessment, Fincher's nutrition guidelines, and so on. Also, we have those health tracking possibilities, and that real-time data collection, early anomaly detection, and some already apps can provide a lot of information for the doctors. And if the app sees that something is wrong, it can give you a very fast detection and message to your doctor that something is wrong with you. Of course, the medication reminders, as I mentioned, at least in cardiology, all of our guidelines are based on preventive medicine, as acute coronary syndromes are like the leading cause of death in Europe overall. So we try to implement as much as preventive medicine as possible to treat those diseases in the early stages, and not only when the patient which you saw, which I referred to. So on digital health apps are really one of those. Personalized plans, progressive tracking, real-time adjustments, educational resources when the patient can read, what kind of diet he needs, what kind of physical activity he needs, and it's adjusted to him. Also, everything is together. Some apps are different, some of them are the same, but all of them have the same result, that we need to involve the patient as much as possible in his overall treatment. So very important thing that with the digital apps, we can make a crucial thing is the report for the doctor, and some of my patients still come with this kind of paper thing, as colleagues showed already, that we still use paper thing data, and from this data is kind of, it's difficult for me as a cardiologist to discuss which kind of medication should I change, the morning one or the evening one. So with the healthcare data, which you see on the left, you can easily see which blood pressure measurements aren't the right ones, and we can easily know which medication I, as a cardiologist, needs to change. Is it the morning pill, pill or the evening pill. So, of course, a very important thing to mention in our healthcare society, we're a lot of discussing about that Germany showed and were the pioneers of DIGAs. So DIGAs are the overall apps on prescription. It's already working, and France is joining the whole thing. It means that if a doctor sees indication for the patient, he can easily prescribe you an app. The patient then connects his insurance company, and the insurance company sends you the code for the app to use. At that moment, 2022, we had 33 apps, which really are regulated. They're checked by various things, various institutions in Germany. There are different types, some of them for health, mental health, some of them are for physical activity and physio after surgeries, and so on and so on. And you can see and appreciate that in the first half of 2002, we already had 4,000 accesses to these apps. It means that the doctors are prescribing the apps already on the daily market. And the other thing is that the patients are using them, and it's changing. So positive care effects are the focus, of course, but the financial savings, as we say, will come later as we prevent a lot of things. Also, as a conclusion, I just want to recap the whole thing, that digital health is bringing a lot of really revolutionary things to us. But as doctors, as physicians, the main thing, as we see from digital health overall, that it's shifting to point of care, and where it should have been all the time, it means the patient. And these kind of meetings, which I really encourage for you as innovators or companies and people pursuing you to innovate things to make my daily practice much easier. So thank you very much.